Hi, I'm Dr. Morgan. Lots of times people ask me about chronic joint pain, and I realize my view of what joint pain looks like is a lot different than what other people's views are. So my daughter Sophia made this nice drawing for us, and we're just going to walk through some of the things that I look at when I think about what chronic joint pain really looks like. Well, number one, we're going to find lots of injuries. There's going to be inhibited muscles. That makes your body compensate. And then after you move around, you're going to have poor motion because it's obviously not working like it should. And that can cause you to compensate in other areas of your body. And then that just becomes, it just kind of builds on itself. And so more compensations, more injuries, more poor movement. And then you get yourself into this mess where you can't compensate anymore. You end up with pain, and you end up with this chronic joint problem. So there's a little more to it than that even, because it's not just about the injuries. So you can't just look at the body structurally. You have to think about inflammation for one thing. It's like this invisible barrier that goes around your body, and you're doing all the things that should be getting you better, but you're not getting better. So it's like you've got two problems. You've got all the injuries and all the structural stuff that need to be addressed, but then you got the other problem of your body's not getting better on its own. And it's supposed to get better on its own. So you have to address inflammation. We have to address joint tissue. Like our body rebuilds and maintains our joints, but if our joint tissue, if it's unable to make it, we obviously can't get any better from that. And these two things are what people call arthritis, which just means your joint's inflamed. So arthritis isn't this big scary thing, it's just like these imbalances that your body's unable to heal. On top of that, we can get to where the pain is so bad that it kind of drives itself. It's like a little hair trigger, and your nerves are so sensitive because they're so used to firing off those pain pathways, they'll just fire off for no good reason at all. So it's like your pain's more exaggerated than it really should be. A few other things that I think of when I think of a chronic joint problem, hormonal imbalances. Because your hormones, like epinephrine for instance, if I fall and I catch myself, my joint should stabilize and protect me so I don't get injured. So if you're getting the same injury over and over, or if you're just getting a bunch of different injuries, it can have to do with how your hormones are balanced, and that actually has a big effect on your ability to get well. The other thing that we talk about a lot with applied kinesiology that I practice is this viscerosomatic muscle imbalances. So just like we can have viscerosomatic pain, it's like you've heard people, if they have back pain, it could be their kidneys, right? So that's the kidneys causing the back to hurt. But there can also be the kidneys causing muscles to not function properly. It doesn't mean you have to have a kidney disease, but it just means that the muscles aren't going to work good. And so that's going to affect the way you move and lots of other things too. So what do we do about it? We take a true whole person approach to these problems. We have to unravel the injuries. So that involves a lot of myofascial work, getting in and working on the muscles and the tissue, kind of like we're waking up those muscles again, unraveling all the compensations. Then oftentimes you're left with a body that is capable of moving well, but it hasn't moved well in so long that it needs to learn how to do that again. So we're going to build a movement practice, and that's good to do to prevent chronic joint problems as well as it is to overcome them. So a movement practice, when I talk about that, it's focusing on quality of movement above everything else. So it doesn't matter so much about speed and strength, but focusing on the basic quality of motion. Now, of course, we look a lot at diet and lifestyle. Some of the very basic things with chronic joint problem is going to be addressing the inflammation. That means no trans fats, absolutely. NSAIDs, so over-the-counter pain and anti-inflammatory medications, they actually make the inflammation worse, and they deplete joint tissue in the long run. So it's like that's not the answer. A high sugar diet is one of the big things that depletes joint tissue as well. Now, in the office, we would do some acupressure techniques. It's basically tapping certain points and toning down some of those pain pathways that are overfiring. But then the biggest thing we do is identify the underlying problem. So it's, you might have some other health problem that might seem minor, but it's been there a long time, it's chronic. It comes back to this viscerosomatic muscle imbalances. If we can find the organ that's under stress and not working like it should, then we can address it, get it working better, and all of a sudden your body starts to be healthy and to heal these chronic joint problems the way it was designed to do. So I hope that helps, and I hope you start thinking a little bit more about the rest of your body when you think about joint pain.